It's another beautiful Tuesday. Amazing time right here. And you know how we do. Every Tuesday at 10:05, we converge here to talk about, disturbing, plaguing ailments that are affecting us right here in Nigeria and even world over. Today is the 22nd day in the month of January 2019. This is Rhythm 94.7, just in case you're just tuned in. And it's the mid-morning cruise. We've got Healthy Tuesdays that starts at 10:05. So that's where we are right now. My name is Awesome Ann, your most awesome voice on radio. I'm not alone. I'm here with my co-host, Blossom Martins.
Yeah, beautiful. Good morning, Abuja.
Great. So we're going to go right into it. The topic for today is one that I hope I don't get too emotional about, because I've known someone who has actually suffered that ailment for about 27 years. Hasn't been really funny, but somehow been managed. But we have Bimisola Ojebode, who is here from Nizamiye Hospital, and she's going to help us do justice to this topic this morning. You're welcome to the show, ma'am.
Thank you.
Great. She's a doctor. She says I shouldn't call doctor, but wait, how can we escape that? Yes, she's a physiotherapist and she's very good with the bones, as her title would imply. So we're going to go right into this. What is arthritis?
Thank you very much. Arthritis is actually an inflammation of joints.
Okay.
And it can affect one or more joints.
Okay.
It's common amongst older women than women of aged 65 years and above. But then it can also affect children. It can affect younger adults too. Statistics says that it's the leading cause of disability in America.
Right. Okay. So I'm aware that there's something called rheumatoid arthritis, because I know someone who's suffering from it, but I know that there are other forms of arthritis. Please, can you help us with that?
Okay, there are over 100 different types of arthritis, actually.
Oh, wow.
But I'm going to mention just few of them.
Okay.
We have degenerative arthritis, which is the most common.
Okay.
Yeah, that's what people call osteoarthritis.
Okay.
It affects women more than men. I think the ratio is 3-1.
Why is that? Sorry, if you don't mind me asking.
Yeah, it has been it has been due to hormonal changes in women, and of course excessive weight too leads to degenerative arthritis.
Okay.
Yeah, what happens is that there's a cartilage in between your joints. So when the cartilage begins to wear off,
right,
your bones begin to rub on each other. This causes pain, stiffness, it causes swelling, and it's also disturbs you from your daily activities. I've seen some patients that comes in and they say, "Oh, I'm not able to pray because they're Muslims. They cannot kneel down because of that." So these are the symptoms you see when you have degenerative arthritis, and age, like I said earlier on, then also previous injury. Like now, if you had a knee injury before, it's likely that you develop a degenerative arthritis. And then how can this particular arthritis be treated? We have so many. Okay, I'm going to come back to that later. Then the second arthritis I'm going to mention is inflammatory arthritis. That's when we have rheumatoid arthritis. It's a very common one. It's a serious ailment. So the goal of rheumatoid arthritis or any inflammatory arthritis is actually to early diagnosis and start appropriate management is very, very important.
I totally agree.
And what happens is that the immune system attacks the joints with uncontrolled inflammation. So this causes bone erosion, which leads to pain. So and also it can affect some internal organs. It can actually affect the eyes. It can affect the different kind of organs. So that is why this is a very serious ailment that needs to be diagnosed on time.
Right.
And you have to give the appropriate management to it. So remission is actually the goal.
Okay.
Remission is the goal, and we treat that with the use of some disease modifying anti-rheumatic drugs.
Okay.
To prevent further damage of the joint. Then another one I'm going to talk about is the infectious arthritis. This is when a bacteria or a virus or a fungus enters the joint to cause inflammation. it triggers inflammation when this happens. So what we do is we use antibiotics to actually treat this kind of arthritis. Then the other one I'm going to mention is metabolic arthritis. This is when you have excess uric acid in your system. It's either you're naturally producing more than what is needed, or your body cannot get rid of the uric acid in time. So this uric acid forms, they build up and they form a needle-like crystals, which has a sudden spike of joint pain.
Right.
Yeah, so, and in this case, the goal is just to reduce the level of uric acid in the system. So, yeah, those are the few types of arthritis that are very common.
Okay.
All right, doctor, having mentioned the few types of arthritis that we have, before you have arthritis, there are these signs and symptoms that your body will be giving you that, yes, you're going to have arthritis later on. Please, can you be very specific by trying to mention most of the signs and symptoms that come up just before you have arthritis?
Okay. For example, when you have pain in your joints,
right,
it's best to see a doctor. You have pain, you have stiffness, or you notice that there's a sudden swelling on a particular joint, maybe the knee joint. You should take action. You should see your doctor, because arthritis leads to a chronic one. I've seen patients that come in and they said, they've had that pain for 5 years.
Yes.
And 5 years you've not done anything. It's so for you to be able to come out of it quickly, you have to attack it. Because you don't even know which type of arthritis it is.
Yeah.
So yeah. So those are the signs. Then also you have reduced range of motion. You cannot bend that particular joint in the direction it should go.
Right.
Then your the daily activities are also reduced.
Right.
So those are the signs.
Okay, doctor. There are some sickness they call old people's sickness, and arthritis happens to fall into one of them. So I want to know if young people also have arthritis. I'm talking of young people below the age of 35.
Yes. Arthritis can affect anyone.
It's sad, as sad as it is, but that's the truth, really.
Yeah, but of course, it is more common in older women. As you grow old, you are likely to develop arthritis because there's something we call wear and tear. Your joints, they begin to reduce in function and all that. So yes, arthritis affects mostly the aged people, but then it can affect children. It can affect young adults.
Really, children?
Yes, I actually have seen children come down with arthritis, and it's such a very terrible sight because they cannot even help themselves, so they're in constant pain. Don't let us go there, please. I feel like it's one of the worst kind of ailments you could ever suffer. Maybe because I've constantly watched someone be in pain. Yes. And then talking about the pain, what is it with the pain? And I understand that there's no cure, or is there a cure for it right now?
Yeah, well, there's no cure for most arthritis.
Right.
But like I said initially, the goal is to diagnose it early enough, and do the appropriate management.
Right.
So we can reduce the damage, we can reduce the pain, but you might not really get a cure for it. But yes, when you attack it on time, you'll be able to manage it and be able to improve in your activities. So because the goal is actually to improve in your daily activities.
That's what it is.
You'll be able to manage the pain, to do whatever it is you have to do.
Right. Okay. Is it something that is generational? Like, can it be found in someone's lineage?
Yes.
Okay.
It can be genetics, especially inflammatory.
Right.
If a scientist says it's mostly genetics and environmental factors, that's inflammatory. So smoking is actually a risk factor for rheumatoid arthritis.
Oh wow.
Yeah.
Are there any other risk factors?
Yes. Age, like I've mentioned before, age is there. We have family history.
Right.
If you have like a mother that has rheumatoid, that has degenerative arthritis, you are likely to also develop that.
Wow.
Then we have some other environmental factors. Then workers, to those that works in like dust, dust industries and all that. Yeah, they are likely to develop arthritis too.
Okay, why is it? You've already explained this, but why is it that most times it's the women that bear the brunt of arthritis as opposed to the men? Like, I don't know what the statistics says, but I'm sure you have the statistics because that's, you're like the experts. But I've noticed, for me, my small statistics, if you have like 10 people, right, and then they're like 8 women, 2 men in that statistic. 8 women will fall down with arthritis and just 2 men. So why is it like that? I don't know. I really don't know. What's the cause of that?
Yeah, especially degenerative arthritis.
Yeah.
Excessive weight. Women tend to have more weight than men. There's a load.
Yes.
There's a load that we carry.
Yes.
So yes. Those are the things that actually leads to degenerative arthritis.
Right.
And I think that is why it is more common in women. And also hormonal changes too.
Oh,
yes,
okay.
hormonal changes too causes arthritis.
Okay, Doc. We also learned that there's some food that you stay away from, or there's some food that make arthritis worse. Yes, that's it. So I want you to, emphasize on that part, okay? Because I know someone who had arthritis, and from time to time they kept telling him stay away from fried things, stay away from processed food, and all of that. Is that a myth, or something that people should avoid?
Well, the reason why they tell them to stay away from some certain kind of food is because this kind of food, they lead to excessive weight. Mm-hmm. Yeah, processed food is not good for us. Too much oil and all that is bad for the body. So that's why they usually say stay away from this kind of food. But technically, there is no food that causes arthritis.
I was going to say that I don't think, just like how you say you don't have excess of something, because everything in excess has disadvantages.
Yes.
So I feel like if you have the right foods in the right portions, yes,
exactly,
you should be able to manage. But talking about management, sometimes I've watched people suffer from this ailment, and I don't know what it is. They've probably tried, every means, but it just feels like something is still missing. Do you get? I know someone has over 20 something years, and then it's like from this to that, and then degeneration continues. From the knuckles is going to the knees. Sometimes you have stiff necks. I mean, like, please, can you further explain? Is there a way to stop and just, stop all those conditions so that you're managing from a certain, point, as opposed to it just continue to degenerate, and over the years it gets worse and worse and worse, and it's almost feeling like this person is probably going to die before you know it.
Yes, doctor. I also want to add to what she said. Okay, I mean, is there a way to stop arthritis from progressing? I think that's basically the point, because it could go from one level to the other if it's not being managed well.
Yes, it can. You can actually stop the arthritis from progressing. And that's why I said early diagnosis and appropriate management is very, very important. Very, very important. And for you to even get an appropriate management, sometimes you have to go through series of management before you know the one that actually works for you. Oh. But then the management depends on the kind of arthritis you have.
Right.
Yeah. For degenerative arthritis, you can reduce the pain.
Okay.
You can reduce the damage.
Right.
By going for physiotherapy.
Right.
It's very, very important.
Right.
Because when you have arthritis like that, your joints tend to lose its strength. So you see some people that they cannot move, not because they don't want to, it's because the joint has already lost its strength. Right. So what we do basically is we help to strengthen the muscles. We help you to improve your daily activities. There's so many things that we do. We help to reduce pain too as well. Then for some other ones like inflammatory arthritis, you have to actually take some drugs, like the disease modifying anti-rheumatic drugs, like antibiotics, some pain relief drugs like that. So the management depends on the type of arthritis you have, but yes, you can stop it from progressing. That is if you take the necessary steps at the right time.
Okay, in case you're just joining in, this is Healthy Tuesday here at Rhythm 94.7, and you can be part of the conversation. All you have to do is to call the number 081 78 947. That's the number for you to call.
We're going to go on a very quick break, and when we get back, it's still Healthy Tuesdays, powered by Nizamiye Hospital. Stay with us. every Tuesday from 10:05 a.m. on the mid-morning cruise at Rhythm 94.7 Abuja as we discuss health-related issues and more. Remember, health is wealth. Powered by Nizamiye Hospital. Okay, just in case you just tuned in, this is Rhythm 94.7, and we have been talking about this very bad chronic ailment known as arthritis. We're here with Bemisola, who is a physiotherapist and who is an expert with treating patients that have been plagued with that ailment.
Okay, in case you want to be part of the conversation, like I said before, now 081-780-947. Doctor, I want to ask about exercising and an arthritis patient. Okay, can you exercise when you have arthritis?
Yes, but you have to be able to balance it with rest. You should exercise, yes, but you must be able to balance it with rest, and that's why it's very important to see a physiotherapist, so that they know the kind of exercises to give to you, because you can't just say you want to start an exercise. We have to know the kind of exercise to give you, what your body can take. So those are the things we actually look out for before we prescribe an exercise for you. So you can actually exercise. Yes.
Okay, and I also know that if you wear too much heels, I know my mom always telling me, see arthritis calling your name in few years to come. So let's also talk about heels and arthritis. Can you, if you constantly wear heels as a young person, okay, will that generate arthritis, later on in life?
Well, wearing of heels have been, it's actually disrupts the weight bearing. It disrupts the center of gravity of your body when you wear heels. So when you continuously do that, of course, you're stressing your toes. You're stressing
the muscles of your knees.
Yeah, exactly. So if it's something you do regularly, you might likely develop that.
Right.
But then that's why we say that there should be balancing. We can't say we should stop wearing heels. There should be balancing. So it's not something you wear every time, 24 hours, 7 times, 7 days a week. So you can. It can, because it's going to disrupt the your center of gravity when you do that, and it puts strains on your calf, your leg muscles. Yeah. So when you continually do that, then you're causing more pain for yourself.
Okay, like going for diagnosis, trying to diagnose if you have arthritis or not. Could it be detected through a blood test or not?
Yes, there are some that can be detected through,
but not all of them.
Okay. Yes, there's some that can be detected through a test. Okay, for example, like uric acid.
Yeah,
the metabolic
arthritis.
Yes, like
most
metabolic
definitely.
Arthritis. Yes. So you have to do like a uric acid test to know the level of uric acid you have in your system.
Right.
So yeah.
Okay, so let's go back to nutrition and arthritis. I know she mentioned the fact that there may be some food you shouldn't eat. No, but for me, what are the foods that you encourage that people with arthritis should actually focus more on? Because I know that I've spoken to a couple of these people and they're eating a lot more of certain kind of foods to help them. I don't know if it's to help the bone marrow, or I don't know if it's to help their muscles. I don't know what it's for, but it's almost seeming like they're placed on a diet, so to speak, to also help to manage the situation. But what do I know? I'm not an expert. So what do you have to say with regards to nutrition and how arthritic patients can cope with the ailment?
We mostly advise that you eat food that are rich in calcium.
Okay.
Because
what kind of foods would those be, please? Just for those listening. Yeah. Right. Okay. Foods rich in calcium. Milk.
Yes. Like milk. Like beans too,
right?
Like proteinous food too.
Right.
Yes, they're very good.
Okay.
Yeah, some that's some of them. Then we also have some supplements too that you can take to also aid, to also help
it's being
you.
prescribed in the
yes,
hospital.
yes.
Okay.
you have some calcium supplements that you can take to help you.
All right. So we've spoken about a lot of things. Just in case you are just tuned in, this is Rhythm 94.7, and we started with the types of arthritis. We talked about degenerative arthritis. We talked about infectious arthritis. We talked about metabolic arthritis. I think I'm missing one.
Inflammatory
arthritis. And you did a fantastic job trying to break down, what would be required, or what we would need to be looking out for if one seems to think that they're suffering from this ailment. And then we've also looked at lifestyle. Let's look at lifestyle once more. What kind of lifestyle would an arthritic patient be looking out for? Aside from exercise, nutrition, does the weather affect? I've heard someone say the weather affects them. That when it's cold, I don't know, it kind of stiffens their bones and their muscles. And when it's hot, they feel a lot better. I've heard arthritis patients complain about that. Can you tell us anything about weather and, those suffering from that ailment?
Yes, weather can actually have its own place too in arthritis, Yeah, like you said, there's some patients that they come in and they say, when it's very cold, they feel pain.
A lot more pain.
Yeah, and, some people say when it's hot, they feel better. Yes, weather can actually affect arthritis too.
Right.
Yes, and that's why you must know what works for you.
Right.
Yes, like I said initially, so you might have to go through different kind of management to be able to get the best one for you.
Right.
So for like a patient comes in and tells me, when it's cold, it's cold and they have this kind of pain in their joints and all that. So I do counter. I try to go the other way, like instead of using cold, because when you have arthritis, you can either use cold or hot therapy to help with the pain. So those are the things. Yeah, they actually affect weather. Then which other one did you mention again?
Yeah, we already spoke about nutrition. Okay, we have a call on the line. We spoke about nutrition and we spoke about lifestyle. That's exercise. So now we just mentioned weather. Yeah. All right, but let's take this call. Hello, good morning to you. Hello, good morning to you.
Hello, good morning.
Morning to you, ma'am. What's your name? Where are you calling from? Hello, we can hear you, ma'am. All right, 08178000947. That is the magic number to call the studio lines right now, so you can talk to the physiotherapist here. And we have been talking about arthritis. I know it's an ailment plaguing a lot of our friends, family, and this is the opportunity for you to find out what you could actually do to manage the situation when it comes to arthritis. All right, 08178000947. So yes, we can go back and while we still try to see if the calls will come through.
Okay, for exercise, we always advise that you avoid repetitive movements. You don't have to do the same thing every time. So you avoid putting too much stress on that particular joint.
Okay.
Then we also advise that you use assistive devices.
Okay, like what?
Braces.
Okay.
For people that have knee pain, we always prescribe knee braces for them. It also helps to take the weight away from the joint. It supports the joint. Then also you need strengthening exercises. It's very, very important. Like I mentioned initially, you can have when you have arthritis, the joints can lose its strength. So we need to strengthen the muscles around the joints for added support. Yeah. So you should actually do regular activity. Like I had a patient recently that came and said for 5 years, she stopped walking because of that, which is bad. Yeah, you should do something. You should walk, but you have to balance it with rest.
Right.
Yes, and also there's some bicycle ergometer, we also prescribe that too for our patients. It's good. It helps to relieve the pain. It also helps it also helps flexibility of the joints. Yeah.
Okay. All right. Let's take this call. Hello. Good morning.
Good morning.
Good morning to you. Hello. We can hear you.
Yeah,
What's your?
I want to ask a question.
Yeah, please. What's your name and where are you calling from, ma'am?
Oh, sorry. I'm Ada calling from Jabi.
Okay, Ada. You're welcome to the show. Go ahead, please, with your question.
All right. What's the place of avoidance of dairy in the and it's the help of avoidance of dairy for arthritis, particularly inflammatory arthritis.
Avoidance of dairy products?
Dairy products, yes.
Like milk?
Particularly, yes, animal dairy.
Oh, animal dairy? Oh, really?
Yes.
Oh, okay.
Because I find that arthritis in general,
Okay.
we've had a case that I've followed, like family related. So we had to get on ketogenic diet to make us people an avoidance of dairy entirely, like a massive change. So, to the physiotherapist, I mean, don't you think? I mean, I know there are researches and papers on how I want to know what your thinking on, you know, inflammation and dairy.
Okay, so you. Okay, Ada. Let me reiterate the question to the doctor, yeah, so she can answer it, right? Okay, so she asked, with regards to inflammatory arthritis, the relationship between, avoidance of dairy products and inflammatory arthritis. Meaning, I think for her own end, they're saying she should not take dairy products. That it would help, for her to sustain or for the family to sustain, inflammatory arthritis. Do you have anything to say to that?
Well, I have to know who actually if it's a doctor that actually told that stay away from dairy foods. Yeah, it can be. Like I said, you can go through different management. To arrive at a particular one that works for you.
Yeah, I know you mentioned that different forms of arthritis will require different management.
Yes, fine. Yeah, your doctor can actually ask you to stay away from certain foods like dairy foods. To prevent it or either to cure it, like to manage it. Right. It's possible.
Okay, so you were talking about bicycle ergonomy. Can you break down that English? We might understand, but my listeners, some of them want you to break it down. Is it bicycling, like riding your bicycle, or is there more to it?
No, there's a stationary bike.
Oh, okay.
It's a stationary bike.
Oh, okay.
It helps to improve the functions of the knee.
Okay.
It also helps with weights.
Oh, okay.
It also helps with maintaining your weight.
Okay.
It helps to strengthen the muscles too, especially for the knee. It's very, very good, to the knee muscles. Yeah, to improve the functions, to strengthen the muscles around the joints, and also for your weight. So sometimes we always advise that when you have arthritis, you can get a bicycle ergonometer in your house.
Okay.
And you can do that maybe 30 minutes in a day.
Oh, okay.
You can start with 15 minutes
in
a day. It's just a way of doing something, because I said it initially, you have to be physically active. Because you have arthritis doesn't mean you should stop exercising, but you just must know the right exercises to do.
All right, doctor, we've said so much about arthritis, but I want you to round up with this. Is it expensive to maintain an arthritis patient?
No. It's not expensive to maintain an arthritis patient, depending on the kind of arthritis you have anyways.
Okay.
And I feel like, let me add this, at what point you detect that you're having the arthritis? If you detect late, I think, I might be wrong, please, but I think it might be expensive if you detect late.
It will be expensive. Okay, let's even remove the monetary aspect of it. Other things.
There's a lot.
Yeah. The stress, the emotions, you can't, because you can't do some things, sometimes you just feel weak. So yeah, it can be expensive in that aspect. But monetary aspects, it might not really be expensive.
Okay.
But that's why I always advise, when you start noticing those signs, like pain, like swelling, like stiffness, you can't do what you used to do before. You should go to the hospital. You should wait for it to get to the extreme before to be severe before you see a doctor or a physiotherapist.
Let me ask a question just came in. Is numbness of your limbs a sign? Could that be a sign?
No.
Okay. All right.
It's not.
Okay. Okay. All right.
Okay, if you have any further questions, of course, you could just go to Nizamiye Hospital and ask of Dr. Bomisola. I'm sure she will get you all of the help that you need in order to get through arthritis. Okay, a big shout out to everyone who was trying to call in, people who sent me text messages, and people who are also trying to get our lines, but it's not going through. A big shout out to all of you. This program comes your way every Tuesday from 10:05 / till 10:35, and it's been an amazing time, Doctor. And I think I've learned so much today. I can maintain an arthritis patient, really, yes. So I think I can. But a big shout out to you. Thank you so much for educating us on things that we do not know about.
Thank you.
Yes, it's time for us to go back to more programming here at the Mid-Morning Cruise. And stick with us from now. We're going to be playing more cool music. And from the hours of 11 o'clock, it is Pink Room, Blue Room with Blossom Martins and also Man.
Every Tuesday from 10:05 a.m. on the Mid-Morning Cruise at Rhythm 94.7 Abuja as we discuss health-related issues and more. Remember, health is wealth. Powered by Nizamiye Hospital.
Identify with the rhythm on Rhythm 94.7 Abuja.